with dignity.
From the Fox Sports Studios in
Roscoe Brown has a mentoring program that trains you for success.
We've got openings from our commercial plumbing department, commercial HVAC. We've got some really great ways that people that don't have experience in the trades but might want to become a skilled tradesman can learn that field.
Get with Lindsay Joyner at Roscoe Brown.
The wages have greatly increased in the skilled trades.
Don't miss out. Call
Roscoe Brown. RoscoeBrown.com. He's local. Certified financial planner Jason Qualls. Financial Coaching Radio. Weekdays at 4 on News Radio WGNS. Rutherford Issues with Brian Barrett on FM 101.9 and AM 1450 Murfreesboro, FM 100.5 Smyrna, and streaming at WGNSradio.com.
Rutherford Issues is powered by Middle Tennessee Electric. They have helped provide light, comfort, and connection to our community since 1936. As your trusted energy advisor, MTE is always here to help. Connect online at mte.com or download the My MTE app. Well, today we have the pleasure of talking with Ella Britt. She is with Volunteer Behavioral Health Care. And Ella, good to have you.
Thank you, Brian. I appreciate so much you inviting me to come today and allowing me to talk about Volunteer, not just an employee, but Volunteer is near and dear to my heart for all the things that we're able to do in the community, and I appreciate the opportunity to share that information. Thank you.
Absolutely. Glad to have you here today. So when you introduce yourself to someone and you say, I work with Volunteer Behavioral Health Care, I'm sure you get the question, well, what is that? So maybe you can help share and shine a little light on that for us.
Of course, I would love to. As a matter of fact, a lot of folks will see the volunteer on clothing and different things, and they'll say, what do you volunteer for? And I love that because then it opens the door for me to share what volunteer really is for us, for Volunteer. We are a private nonprofit organization, Brian, and we're also a United Way agency, and we're thankful for that. I do want to say, our mission is to serve individuals and families and communities through prevention, treatment, and recovery services. We are wanting to ensure that help today leads to a better tomorrow for those folks that are in our community and in our state. And so we actually cover 32 counties. We have 22 offices in those 32 counties, and we are a mental health and substance use provider. So we serve those that have mental health needs as well as substance use needs throughout that 32 county area.
And that obviously includes Rutherford. Is Rutherford and Cannon kind of in one area?
Yes, it absolutely is. We have a location here in Murfreesboro, and we have one in Smyrna as well. And so we are able to serve the counties that are surrounding us. Some of the counties that are not even counted in our 32 county area definitely get services from us because we actually are a no wrong door virtual provider now. And I think COVID really helped us to maybe find our way to get folks to appreciate that. Let me explain to you a little bit about what that means. So whenever someone needs a service, they can call a number. We have one number that everyone calls when they call in, and it's our first appointment line. And that is a virtual service. So whenever they call in, it offers clients services at the time they need them. They receive an assessment, a care management appointment, and a medical evaluation if needed on the day of the initial call. This is something that we have wanted to do for a long time, but getting people to make it into the office can be very difficult. Transportation issues, scheduling issues. And so we're able to help clients with anxiety and social phobias, paranoia, PTSD. All of these services they can get assistance for sitting in the comfort of their home and talking to our professionals.
Is it only during certain hours, or when is that available?
It is. Thank you for asking. Yes, it's 8 o'clock to 5 every day, Monday through Friday, so every work day. And then there are times when folks may call and it's close to the end of the day. So obviously, if we can't do an assessment immediately with them, then we schedule that for the next day. Our goal is to do that as soon as possible, as quickly as we can. And just, again, to help remove those barriers of transportation, of stigma, and time constraints that happen for a lot of folks.
Sure. And I would think as well, the person who may be dealing with some mental health issue or substance abuse, I want to get help. But then making that initial phone call is a huge first step. And if you can give them some assistance right then immediately, that helps, because sometimes maybe it's a phone call, even making an appointment, but do they ever make it in,
Exactly, and we have seen that. As a matter of fact, now that we have gone to this program, we have 81% intake appointment rate of appointments that are kept.
Wow.
And that is unheard of in pretty much any business where you have a a consumer coming in to get services. I'm going to go ahead and share that phone number for that first-time appointment line. It can be found also on our website at Volunteer Behavioral Healthcare System. But that appointment number is 877-567-6051. And Brian, you were talking about, those immediate needs. We also have a crisis program. We provide crisis services. One of the things we're really excited about is that we did receive a grant early this year for a crisis stabilization unit to be opened here in Rutherford County in Murfreesboro. That crisis stabilization unit, it's a short-term, 3 to 5 day mental health residential program that's available to people who are experiencing a mental health emergency. We are in the process of construction on that right now, and so we're looking at early fall being able to have that available. We do have a CSU unit already open in Cookeville, Tennessee that we utilize at this time. And that is funded by Tennessee Department of Mental Health and Substance Abuse Services. So as always, we want to thank our Commissioner Williams, and of course Governor Lee for their support of this program for the members of the population of Tennessee.
Now, where is this being constructed?
The office that we have in Murfreesboro on Williams Drive, it's 1504 Williams Drive. When we built that building, our administrators, our CEO, they had a plan that they wanted to have this program. And so it was a matter of getting the funding for it. So when they constructed our new facility, they left half of the bottom floor. We called it the rocks, because it was like gravel, or the gravel rather. We called it the gravel. We would meet sometimes in the gravel, but it was unfinished. So from the outside, it looked finished, but the inside, we were waiting to find out what grant funding we could get and what their requirements would be around building that. And so it's right there in our outpatient office facility on the bottom floor, and construction is going hard and heavy right now.
Well, that's awesome. Now, that's over in the Gateway Medical Center Parkway area.
Yes, it is.
So, and so it's convenient to that seems to be our healthcare hub here in Rutherford County, that area. So,
yes,
we have Ella Britt joining us, Volunteer Behavioral Healthcare today. That unit, when you say mental emergency or mental crisis, what would that look like?
So oftentimes what we have seen happen is our police officers respond to a call, and I'm blessed to say that we have co-responders now that are mental health trained, that work with the police department, that ride in the cars with some of the officers as a team. And so they will get to a call, and when they get there, after further investigation, it appears that there's a mental health issue going on, some instability that the person is struggling with. And so instead of just taking them to the jail or a holding cell or the hospital emergency room to sit in, they'll be able to drive them to us. And that way they can bring them to us, we can assess them, we can put them, in place there if that's what they need, find another placement for them if that's not what they need, and then that allows our friendly officers to head back out to the next call, because that takes a lot of time that they're unable to be helping the next call that comes in as quickly possibly. So,
sure. And it gets the help immediately. I'm sure that you've had lots of success with the facility in Cookeville, so you really know. I mean, you can hit the ground running here in the fall when this is ready for occupancy.
Yes, absolutely. And I'm glad you said it that way, because that brings up one item that we are working on at this time. As I'm sure you well know, we have had a workforce shortage in Tennessee. And so right now we are needing to hire our RNs, LPNs, crisis intervention specialists, care managers. So anyone that's credentialed that's interested in working with us in our new CSU unit, as well as in our other offices, if they go to Volunteer Behavioral Health Care Systems, it's vbhcs.org. And then they can see what positions are available. If they would like a career with us, we would love to interview them.
Okay, so VBHS, I'm sorry, I did it wrong, VBHCS.org.
That's correct.
Gotcha. And that's just the first letter of Volunteer Behavioral Health Care System.
Yes.
All right, very good. Ella Britt is our guest here today. And you mentioned the word COVID a minute ago, and we have seen numbers, there are stories everywhere about the mental health issues that came along with that pandemic and substance abuse, all of that. It's been a tough time, and we're going to be dealing with those ramifications for quite some time now, aren't we?
Yes, absolutely. We have had a lot of people come in with concerns, mental health needs that I don't think we'd seen that number previously before COVID. Of course, a lot of people that were home and couldn't leave and couldn't go, their jobs were impacted. I mean, their lives were turned upside down. And so there's a lot of anxiety disorder, stress management needs, so many things that I think COVID really brought to the forefront that we're trying to help folks with.
Yeah, very much so. We've got a few minutes left here. Anything else you'd like to pass along?
I think, one of the things that folks aren't really familiar with, I'll just share since we have another minute, we have what's called peer support centers, and we have 10 across our 32 county area, and that's like a safe, friendly place for consumers of mental health and substance use disorders to kind of come together. There's some recreation, there's some education, and we have one that is located here in Murfreesboro. So whenever we have clients that we're working with, we let them know, we orient them to that facility, and it's just a place that they can go spend some time, and it is actually overseen by in the facility. We have consumers that are doing really well, that are working with other consumers, so they can talk the talk with them, and it really seems to help.
Well, that's awesome. And VBHCS.org, where you can get a lot of information about volunteer behavioral health care. I did want to bring this up because we've talked about mental health and even mental health emergencies with the new center that's coming in the fall, substance abuse, things of that nature. If someone is experiencing, a mental health issue, an emergency, substance abuse, and want help, what's the first step that they need to make? Is it just make that initial call?
So if it's a crisis situation, we have a number for crisis. Because that crisis number is 24/7.
Okay.
And that first time appointment, of course, is just 5 days a week, 8 to 5. So that crisis call number is 800-704-2651.
Okay. And that's the number to call anytime. Now, is health insurance, does that cover the cost, or how does that work if someone is, because we don't want that to be an obstacle for them not to get help?
Of course. So we have the crisis contract with the state of Tennessee, and so that's not an issue. When they call for crisis and it's a crisis situation, they're not going to be charged or billed for that. We do have the adult crisis program. We do not have the adolescent crisis program. That is through youth villages. Okay.
And so that is very important information. You just want to make sure that there's no barrier. There are often, we can make excuses all the time, can't we?
Absolutely.
So anything else you want to pass along here, or did we touch the bases?
I think that's it. I just really appreciate the opportunity to come by and share a little bit about us. We want people in the community that have needs to know we're here for them. We want to help any way we can. If they're not sure what they need, call that first-time appointment number, and our trained staff will help figure out what they're looking for for and get them to the right place.
Well, we will put a link to Volunteer Behavioral Health Care website on our website and on the podcast, so be sure to check that out. And Ella, thanks for stopping in today. It's been fun.
Thank you very much.
Ella Britt joining us today with Volunteer Behavioral Health Care. And again, you can find them online at vbhcs.org. That stands the first letter of Volunteer Behavioral Health Care System. All right. Have a good day, everybody.
This is John at L&K Trophy. We have a wide assortment of plaques. We have colored tumblers that we can engrave. They work great for